Hello, this is Adam Schaefer. The innovation I will speak about with you today is the bed-mounted sequential compression device. I will first describe the thought process that led to this innovation. Next, I will give a pitch for the bed-mounted SCD. Third, I will discuss the impact the bed-mounted SCD would have on the framework of innovation categories of cost, quality, and access. And lastly, I will touch on the resources needed to make this innovation a reality. The idea for this innovation came about one day during an ankle surgery in which I was circulating. The cords from the SCD were getting caught on the C-arm, the X-ray device that takes pictures of the patient in the operating room. Got hooked around the bottom here, and when they went to take a lateral image so that when they spun the C-arm around, the SCD cords got caught, dragging the pump with it. It was very possible for it to cause a break in the sterile field and perhaps an infection to the patient. Not as likely to cause an injury to the patient by pulling the leg off, but still possible, pulling the leg right off of the operating room table. But it definitely caused a frustrated circulating nurse who had to go underneath the surgical drapes but above the bloody floor to free all of the cords to get it out of the way of the C-arm so that it could take the picture and so that surgery could resume. This experience led me to reflect on prior experience when I was a nurse up on the floor and had troubles with the SCD pumps as well. Confused patients, I thought it would cause them to fall, especially at night, especially when they were hooked up to the SCD pump and trying to walk away. The research apparently does not support that argument, but I did not see research that would that looked into how the SCD cords would trip us, the nurses. And I do remember tripping over these cords. Stumbling through cramped rooms in the middle of the night, and I remember hooking everything up just as I was supposed to do with the SCD pump, just to find out that the cord wouldn't reach all the way from the outlet when the pump was hooked up on the foot of the bed. It's estimated that the compliance for SCD pumps is about 49 to 59%, at least in one survey that Obi at Alia did. And it's not much wonder since there is such low compliance when these systems are so frustrating to the staff. My solution was to design a bed-mounted SCD pump. There were several requirements that would be needed for this to work in the operating room. This picture here is kind of an exploded view where the pumping mechanism would be inside this little white box, but I just wanted to show that the pump would go through the cords, pushing the air through to the pumps itself. This part would be mounted to the table, and the power supply would go out towards the head of the bed where the power supply would go for the operating room table. This thing would need to be waterproof. I have shoulder scope cases or knee scope cases that use anywhere from 6 to 12 liters of irrigation. A lot of that can end up on the floor, so it'd be possible to get that thing wet. Also, it's bloody in the operating room. The power supply would need to go in the same direction of the operating room table, or even more preferable, would be able to plug right into the operating room, the OR table. The pump would need to be within the confines of the bed laterally. It couldn't protrude from the sides of the OR table because the staff and the surgeon need to stand there in order to work on the patient. It would need to be small enough so that when the bed was totally collapsed down to its lowest point, that it would not get crushed, and it would need to be removable to be maintained. I misspelled it. And it also has to fit on the most central part of the operating room table because the operating room table itself is very modular. The head of the bed often will go down to the foot of the bed for ankle surgeries to give more room for an X-ray to get through here. The head will come off all the way to put a different piece on there for a shoulder surgery to sit the patient up more upright. So there's not a lot of space for this thing to fit in. It has to be kind of right in that area right there. So without further ado, the pitch would be: circulating nurses, have you ever prepped a patient, helped with sterile drapes and positioning, only to find out that the SCD pump is in the way, with the hoses in danger of tripping the staff without easy access to outlets? Is it impossible to get the cords around the table and out of the way? problem is the solution. The bed-mounted SCD pump is part of the bed. Simply hook the SCD tubes into the bed-mounted SCD, plug the table in as normally, and all the benefits conferred with sequential compression are yours without the trip hazards nor the hassle. Find out more about this innovation today. This innovation fits into the overall framework of quality, access, and cost for quality causing less OR trip hazards. There would be less cords in the way, as described in the pitch. There would be better compliance with sequential compression. As stated before, the compliance was 49 to 59%, and the nurses can do other things to help keep surgeries running efficiently. That would decrease delays for other patients. That would increase satisfaction for patients, increase satisfaction for surgeons. As far as access goes, it would be the same as now, because it would be using the same pumps, only hooked up to a different pumping mechanism that would be right there. So once it was actually installed in the bed, the access would be the same. Cost, there's a wide divergence of cost for SCD pumps. The one I found online is about $800. I'm assuming a hospital will get wholesale on that, but I don't know exactly how much it would cost to produce or to make or to sell. But I do know that the cost of a pulmonary embolism is about $8,763 per patient, not including patient deaths, and the cost of an SSI or surgical site infection was $3,000 to $29,000 per patient, or $40,000 when the patient's over 65 years old. So if those could be reduced, the cost of the pump itself might be worth it. Resources needed to produce this innovation would need, first of all, better design. That goes without explanation looking at this picture. There would be capital that would be needed to produce the actual innovation. There would need to be a operating room that would buy the product, and then there would need to be in-service materials to actually train the staff on its use and train other maintenance staff on how to maintain it. The references I used are listed below, and thank you very much for your time.